Hi, this is my roommate Jacqueline. She'll be my patient for the swallow evaluation for today. So first things first, we're going to check Jacqueline's overall awareness and check to make sure there's no dementia and that she can understand basic commands and that she understands the world around her and all that stuff. So Jacqueline,
Yes.
When is your birthday?
My birthday is May 15th, 1996.
Okay, so what's the weather out like today?
It's kind of rainy today, breezy, overcast.
Mm-hmm.
Yeah.
So what day of the week is it?
It is Monday.
Okay, so as we can see, Jacqueline is very aware of her surroundings and also observing Jacqueline's respiratory pattern. It doesn't seem like she has any problems with breathing, so that could also be a big factor in swallowing. As we can see, she doesn't seem to have that problem. All right, so next we're going to look at Jacqueline's facial symmetry and looking towards the camera. As you can see, Jacqueline doesn't have any drooping on either side of her face. Her face is very symmetrical, so there's no cranial nerve 7 damage. Now we're going to look at your jaw movement. So we're also going to check for cranial nerve 5 damage. So could you open your mouth really wide? All right, now close it. Now open it again and move your jaw side to side. All right, just like that. So there is no cranial nerve 5 damage. She has very good control of her mandible. She can open and close it at will. And next we're going to look at her lip symmetry and strength. So again, we're looking no drooping on either side. Now I'm going to test your lip closure. So I'm going to poke you I'm going to poke your mouth with a popsicle stick and don't let me into your mouth, okay? So keep your lips closed and I'll poke. Okay, so Jacqueline has good lip closure. There's no excess secretions on either side of her face, so she's not drooling. She can keep her mouth closed, and that's good for when we're doing oral preparatory and oral phase and swallowing, so that she doesn't have any material falling out of her mouth, and she has good pressure to propel the bolus backwards. Next, we're going to look at cranial nerve 12 damage. From the lips, there's no cranial nerve 5 damage. So now we're going to look at cranial nerve 12. We're going to look at her tongue. So again, Jacqueline, please open wide. I'm going to look at your tongue. All right, as we can see, Jacqueline has a symmetrical tongue. She doesn't have it deviating to either side of her mouth. It's right in the middle. That's good. It's a good pink color. There's no scarring. All right, now Jacqueline, can you stick your tongue out for me? And I'm going to push against it with the popsicle stick, and I want you to push back against it, okay? All right, now I'm going to poke underneath your tongue and push it from underneath. Just like that. Yeah, you're doing it right. Now I'm going to put it on top of your tongue and push up towards the roof of your mouth. All right, very good. So now we're going to test. So her tongue strength is very good. That is good, again, for propelling the bolus backwards, for manipulating the food during chewing so that she can form a bolus in the first place. So now stick your tongue out again. And to the side, to the other side, up and down. And as we can see, Jacqueline has good range of motion. Again, very good for propelling the bolus back into her mouth, for forming the bolus, for lingual lateralization so that she can place the food in her mouth, whichever side that she wants to be on her molars. So that's very good. So tongue symmetry and everything is very good. Tongue strength is very good. Now we're going, for the speech part, now we're going to do the repetitive syllables. So can you say pa 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 as fast as you can?
Pa 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 pa.
All right, very good. Now can you say ka 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 ka?
Ka 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 ka.
All right, now ta 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 ta.
Ta 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 ta.
Very good. Now for your in-breath support too, take a deep breath and say patika patika patika. All right, so take a deep breath and say it as many times as you can.
Patika 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 patika.
All right, very good. So there's no sign of any aphasia, dyspraxia, or anything like that. Jacqueline can say all of those consonants without any problem. She can alternate between the consonants in her mouth, so she can do front vowels, front consonants, middle consonants, and back consonants with ease. So now we're going to test her laryngeal function before swallowing. So can you say E, 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 in a long, take a deep breath and say E, 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 E.
Okay. E, 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 E.
All right, very good. So she can, again, she has good laryngeal control. Now we're going to test for alternating between vowels. So can you say oo, E, oo, E?
Oo, E, oo, E.
All right, very good. So again, she can alternate between vowels. She has good laryngeal control. Next, we're going to look at her buccal control. So I'm just going to tell you to do certain actions. You don't have to repeat after me, but just, for example, say kiss a baby, you just make a, motion between.
Okay.
All right, so for the first one, blow out an imaginary candle. All right. Now for the next one, lick an ice cream cone. All right. Now lick milk off your top lip. All right. Now sip through a straw. Okay. Now kiss a baby. All right. So as we can see, she has good buccal tension, which is good, again, for keeping food inside her mouth, for maintaining proper lip closure while swallowing. No problems with that. So next we're going to look at her oral structure, so your velum. So I'm going to have you open wide again, and I'm going to look at the color of your velum, the symmetry, and everything seems to look good. There's no scarring again. Another thing I should mention too is Jacqueline doesn't have a tracheostomy tube, so that goes along with like respiration and everything. She doesn't have that, so that again is not a problem. For her velum, she has good symmetry at rest. Now I'm going to have you do open up again. And can you cough for me? All right, very good. So she has good velum motion. And now I'm going to do a quick gag reflex test. And I promise it won't be that bad. I'm just going to stick back there. And if you don't gag, there's no big deal. But we're going to test for cranial nerve 10 damage. All right, very good. So Jacqueline has a good gag reflex. Cranial nerve 10 isn't damaged, and she can, dispel any material that's harmful to her. Has feeling back there so that in case, food or liquid does happen to go down to her larynx, she could cough it out instead of aspirating. So she has sensation, and that's good. Next, we're going to look at the swallowing. Now we're going to swallow. We're going to actually do that. So without having any liquid or food in your mouth, I'm just going to have you just swallow normally, and I'll feel your throat. All right, very good. So I'm checking for hyolaryngeal excursion to make sure that her larynx is being closed off, leaving way for the UES to open for food to go down into her esophagus. Very good. So she doesn't have any problems with that. The oral transit time is good. There's no delayed reaction in between phases that I can tell. All right, now we're going to have you drink or take 3 sips of this. So drink it sequentially. Don't try to gulp it all down at once. Okay. And I'll feel your throat while you do that. Okay? So this is 3 ounces of water. Very good. Very good. Okay, so again, doesn't have any problems with transitioning between the oral phase and the pharyngeal phase. Hyolaryngeal excursion is good, and she can self-feed herself. Self-feed. Yes, that is good. So now we're going to try through a straw, and this is a pretty big straw for a tiny cup, but we're going to try along with that, and I'm going to feel your throat again.
Okay. 3 times again?
Oh, 3 times again. We'll do 3 times. All right, again, very good. So the presentation of the thin liquids isn't a problem for Jacqueline so far, but now we're going to try it with a teaspoon or a spoon of water. So have you, maybe if you can, I don't know if you don't want you to spill it. Here you go. Yeah, and then have you drink through that. All right, so again, very good. The presentation of the thin liquids is good. Now we're going to move on to a little bit thicker with a banana. Jacqueline has an autoimmune disease, so we can't use crackers or anything like that. That's something you probably have to consider with patients. As you go through, you're going to see a variety of people and a variety of dietary recommendations. So we're going to use a banana. And Jacqueline, I'm going to have you eat this little banana. Okay. And I'm going to, again, after you eat, I'm going to check your anterior and lateral sulci to make sure there's no material still present or residue. I'm going to check the back of your throat and have you say, offer me to make sure that you don't have any vocal, gurgly vocal quality, and make sure that there's no residue back in your throat. Okay? So I won't fill your throat this time. Just have you eat it. You don't have to eat the whole banana. Okay. Yeah, it's okay. So, yeah, or eat the whole banana. Eat the whole thing. Okay, so Jacqueline is chewing the banana. There seems to be no problem with keeping the banana in her mouth while she's chewing. She has good buccal tension, good lip closure, and good tongue control. All right, so now I'm going to check your anterior and lateral sulci to make sure that there's no residue. All right. And there is none. So Jacqueline is able to clean out her oral cavity very well. Now, can you tilt your chin back and say, ah?
Ah.
Now, can you say, hello, my name is Jacqueline?
Hello, my name is Jacqueline.
All right, great. So there's no vocal quality change to her. Doesn't have any gurgling in the back of her throat. Doesn't have any residue that we can tell. All right, so now we're going to go to a little bit of a harder texture, which is almonds. So I'll have you eat as many almonds as you want. Go for it. And Jacqueline will probably have to have more, chewing for this. It's going to take a lot more effort than the banana or the water did. So we're going to check on that. All right. You want another one? No.
You have another one. To you.
All right. Very good. So now we're going to check your anterior and lateral sulci. Make sure that you can clean your oral cavity again. Very good. Can you tilt your chin back and say, ah? All right. Now can you say, hello, my name is Jacqueline?
Hello, my name is Jacqueline.
All right. Very good. So Jacqueline, again, doesn't have any trouble with that. So that is the end of our clinical bedside swallow evaluation. Jacqueline doesn't appear to have any dysphagia or dysphagia-like symptoms. She's a very good, swallower. All right. Very nice. So thank you very much. And that's it.